Dealing with vaginal yeast infection, also known as candidiasis, can be really troublesome, but the treatment is straightforward. Before we dive right in, I want to talk about how you can prevent this yeast infection. You know the saying that goes, prevention is better than cure. So, how to prevent it? Number one, you try to keep your intimate area dry as possible. It's important to know that these yeasts they thrive in a warm and moist environment. So avoid wearing tight underwears, okay? And always make sure that the intimate area is properly dry. Next, try to avoid douching. Douching happens when you use either scented products to wash your vagina. Now, the place you're seeing, what you're seeing in your intimate area is not your vagina. It's actually the vulva. The vagina is a canal. The vulva leads to the vagina. So douching happens when you use scented products in the bid to make inside clean. So you use it to wash inside. You put your hand inside, stuff like that. That is douching. But by doing this, you're disrupting the normal balance of the vagina. The vagina should be slightly acidic, but by doing this, you're disrupting the balance. As well, you're also eliminating the beneficial bacteria because you're washing that place. You're not supposed to. You should just keep the vulva clean and not the vagina. Vagina has its self-cleansing mechanism, right? The next one is by wiping from front to back, not the other way. When you wipe from your anus to your vagina, you're dragging the bacteria that is supposed to be in your anus, maybe by measure of your poo and all, to the front, which is not proper. Remember, when there are so much bad bacteria, it would it would weigh down the good bacteria, which means that it will disrupt the balance of the good versus the bad bacteria. There are good bacteria that are beneficial for your vaginal health. So when you drag the bacteria from your anus to your vagina, you're disrupting this balance, right? Then another way you can prevent this infection is by use of probiotics. Probiotics can be gotten as a supplement, or you can also get it by intake of yogurt, unsweetened yogurt. Now, there are studies that shows that probiotics can actually help balance the beneficial bacteria as well as the lactobacillus yeast that are beneficial in the balance of the vagina. Now, how do you even know that you're having yeast infection? Of course, you cannot treat what you don't have. So it's important the symptoms to look out for before you would say, I think I'm having yeast infection. The following signs can point out to vaginal yeast infection. One is irritation and itchiness of the intimate area. If you experience severe irritation, by irritation, I mean you experience itchiness, you feel like scratching your vagina often, then that is a pointer to yeast infection. But not only that, secondly, if you experience white, thick discharges, discharges that are not foul smelling, basically odorless, or rightly cottage cheese discharges. Cottage cheese smells like bread. How your bread smell? That how it smells. That smell, that is how vaginal yeast infection smells. It doesn't have to be foul smelling. If it's foul smelling, then most likely it is not vaginal yeast infection. Another thing is if you're having burning sensation, you feel so hot in your intimate area, even when the weather is not hot, it just feels so uncomfortable. Then, if you're feeling redness and inflamed around your vulva, of course, this happens because of the irritation that is taking place, and as a result you're scratching your vagina to feel better. In the process it gets inflamed and red, so the vulva literally appears angry. So these are the signs to look out for. Then to cap it all, you run a test, either urine MCS or vaginal swab. High vaginal swab, MCS, can show if you're having vaginal yeast infection. Next is the treatment option. How do you treat vaginal yeast infection? There are over-the-counter medications ranging from creams and suppositories. By suppositories, I mean inserts. Then there are also prescription oral medications that can be taken. So depending on how this has been occurring, if it's a case of reoccurrence, maybe you've had it 4 times straight in a year, your treatment shouldn't be like someone that just had it for the first time, because that would make it to still come back. So if you've had it 4 times straight in a year, you should see a doctor for a different type of regimen of treatment. If that's your first time having it, or you've had it once or twice, then most likely the conventional treatment will do the job. Now, like I said, for the treatment, you have the over-the-counter creams, both the ones you can insert, and then the suppositories that comes in a form of tablets that you also insert. Some of them, the insert can last for 1 day, some of them for 3 days, while for some as long as 7 days. Whichever one is fine. Then for the prescription medications, is also antifungals, but they are usually based on prescription, right? Then the following are categories of people that shouldn't get vaginal yeast infection treatment by themselves. They have to consult the doctor. The first categories of people include the people that are experiencing it for the first time. This is because they might mistake it for either bacterial vaginosis, or they might mistake it for sexually transmitted infections, that is STIs. So it's important they consult a healthcare professional, maybe a pharmacist or a doctor, to find out if it's actually vaginal yeast infection they are having. The next category of people are pregnant women. Pregnant women, due to hormonal changes, which could literally lead to disruption of the pH of the vagina, tend to have recurring yeast infection. This category of people should not self-meditate, but they should not self-medicate, but they should consult their doctor or their gynecologist for the appropriate treatment. Not all forms of treatment is suitable for them because they are pregnant. Then the last category of people are those that are having recurring yeast infection. Like earlier said, if you've had yeast infection 4 times straight in a year, a particular year, then it's a case of reoccurrence. Your treatment would be different from the basic treatment, because doing the basic treatment would still mean that the yeast infection will keep on coming. I hope this helps.